Hi everyone, my name's Tanya, and together with Abiha, we have created a presentation on mental health, specifically looking at how it impacts racialized communities. We hope you enjoy.
Now, I think it's important to start off with the definition of public health. So, what is public health? Well, public health is an organized effort of society to keep individuals and communities safe, healthy, and prevent illnesses, injury, and/or premature death.
There are three objectives of public health. The first is protecting health, where we look at minimizing or preventing illness or injury before it has occurred. The second is promoting health, which enables individuals to increase control over their health. And finally, preventing disease, which uses upstream interventions to promote health and prevent disease.
Now, in order to talk about public health, we need to first talk about the social determinants of health. Social determinants of health are the non-medical factors that influence an individual's health and/or life trajectory. Listed on the screen are a list of factors that can have the potential to make a Canadian sick. 50% of these factors are due to social factors that can have the potential of harming an individual's health. Race, gender, income, and education are only some of the indicated factors that can play a role in an individual's mental and/or physical health. Not all health problems are influenced by biological determinants.
So what is mental health? Mental health is all about our social, emotional, and psychological well-being. When there are disruptions or stressors that occur in our daily life with family, school, or work, they can cause changes in the way we feel, think, and behave. To put this into context, here are some statistics. 1 in 5 of every Canadian experiences mental health or addiction problems. 70% of mental health problems typically onset during childhood or adolescence, and there's a link between an individual's mental health and physical health. For example, people who experience long-term chronic pain are more likely to develop a mood disorder. In addition, 39% of workers in Ontario indicate that they would not tell their employers about any mental health illness.
Now, as public health educators, our role in society is to inform and educate people about public health and what role it plays in our lives. Many Canadians face mental health challenges, and in order to address the problem, it is important to understand how mental health and public health correlate. Mental health illnesses can have the ability to affect an individual indirectly or directly. Risk of poor mental health can be associated with socioeconomic status, gender, education, and/or race, which are also a few of the social determinants of health that we had mentioned before.
Mental health is highly prevalent in many racialized communities such as the South Asian, Black, and Indigenous community. In Canada, the largest visible minority group is South Asians, and a highly prevalent population resides within the Peel region. The Peel region consists of the following GTA cities: Brampton, Mississauga, and Caledon. Many of the mental health stressors that South Asians face in Peel region was due to their intergenerational and cultural conflict, academic and relationship, and even financial stressors.
Health stressors can contribute to a number of issues such as depression, anxiety, and drug use. Experiencing mental health illnesses as a youth can be a very critical process. In a study conducted by Farah Islam, 50% of the cases were lifetime mental illnesses and addictions that had begun before the age of 14, and 75% of cases were before the age of 24. Youth that were interviewed for this study had stated that there weren't enough resources available for the South Asian communities to reach out to and get help. Youth who were able to access mental health services were able to do so due to the help of social workers and other resources.
There are many challenges and barriers that lead to mental health problems, some of which are listed here on this slide, and include a lack of resources, language barriers, discrimination, access to information, socioeconomic status, and stigma. The many social determinants of health related to this topic are socioeconomic status, education, social exclusion, and ethnicity.
If you or someone you know is interested within a career in the public health sector, some public health careers focusing around mental health are health promotion specialist, a public health nurse, social worker, or mental health counselor. And to end off this presentation, we wanted to provide a list of mental health resources that are available within the GTA to Black, Indigenous, and people of color.
Thank you so much for listening. We hope you enjoyed our presentation and learned a little bit about mental health and how it impacts our communities.